Hi, it's Wednesday. I got a lot of letters while I was off and wanting to know about hospitals and emergency rooms and this type of thing. A lot of people wrote to say that they always are creeped out in a hospital. They never feel comfortable. They feel like they're always being watched. And some of that may actually be true. I'm going to go through the different process that I went through before I had the surgery on July 15th. Okay, so meeting the doctor in the office. Any medical facility is going to have earthbound spirits. If the spirit is not there with another patient, or the staff doesn't have somebody attached to them, there's usually always somebody there, especially if it's a very big office. Not so much, a single doctor with a receptionist and one nurse. That's usually a little bit less. But if it's a big office, or if the office is in a hospital, that makes all the difference in the world. There was at least 2 ghosts in the doctor's office when I went to see him. Then I had to go for pre-testing, which is done in a hospital. And let's face it, you know what's coming, you're nervous, who's ever with you is nervous, and pre-testing, you already know what they're looking for, but then you're worried, are they going to find something else? And so, particularly the hospital that I was at, there was an older man there that was in a wheelchair, and there was a ghost of an older woman with him. And no, I'm not in pain. The cat's acting up again, so just so you know. And she had to be his wife, all concerned that, her husband was sick and she was with him. There was also a woman and a man with a little girl, maybe 11 or 12 years old, getting tested. And there was a child with them, and I'm going to, probably a sibling. You have to realize that when I see these spirits out in public, unless I actually stare at them, they have no idea that I can see them. I don't start conversation. Basically, it's none of my business. If I actually want to get their attention, I'll wink at them. And then they pull one of me, and then I can go forward. But I pretty much just keep my mouth shut. Now, before surgery, and that's always interesting, you get to the hospital at 4 o'clock in the morning, and there's other people there coming in for procedures also. And again, bustling. The nurses, the doctors, the anesthesiologists that come around. Questions. It's when you wonder how many times do you have to keep answering the same questions over and over and over again. And yes, at the hospital that I was at, there were definitely spirits in that room also. When I went into surgery, there were 3 ghosts in the surgical room. I asked 2 of them to leave. The third one was not paying any attention to me whatsoever. And of course, at that point, I'm not even sure if my mouth was working right. And so when I got into the recovery room and I woke up, at first I did not see anybody in the recovery room. There was a nurse there that did have somebody attached to her. I don't know who it was. I did not talk to them. And then they move you down to your room. And most of the rooms now are private, which is nice. And how many of you have ever been in that situation where you just know you're being watched? And you probably are. Again, you don't feel good, you're in pain, that's energy. Remember, they don't eat or sleep. They need human energy to keep going. And so people that are coming to visit you, they want to have a happy smile face, and they look at you, and they don't have to talk. You know what they're thinking. So, but then they say you got to get up and you have to walk. And when you walk up and down hospital floors, what do? You glance into everybody's bedroom. There's usually a ghost in at least half of them. Now, this is not just the hospital that I was in. This is any hospital. And to be honest, if it's a city hospital, the emergency room in a city hospital is like 10 times worse than the emergency room in a regular hospital. So definitely there are ghosts there. Now, what I tell people is if you've got a ghost attached to you, or you have negative energy on you, any tests that you'd have taken, wherever you're at, it's not going to be accurate, because the ghost is definitely going to, standing in that room, it's going to affect the electric, and 9 times out of 10 your physician will go, gee, there's nothing wrong with you. But if there is, that could be really dangerous. The other thing is, I tell my clients, if you're going in for any kind of surgery, if you're having surgery from the waist up, tape a quince seed on your big toe. As soon as you get in there before surgery, they take everything off of you, and then they make you wear those socks. Who's going to know if you've got a seed taped to your toe or not? Nobody. And the other thing I tell people, if you're having surgery from the waist down, tape one to your back. If you have a seed on you, no earthbound spirit can get within 3.5, 4 feet of you, which is a really good thing when somebody's got you cut open. I want to show you something. This is what a quince seed looks like for those of you that don't know. I think you can probably see it pretty clear there. This is the way it looked when I put it on my big toe. When I came out of surgery, a couple days later when I had my wits about me, this is what the seed looked like that was taped to my big toe. This tells me that there was definitely an earthbound spirit in the surgical room that was very close to me, and that's why the seed popped. Still works 100%, but that is what will happen, and that is exactly how you can tell if there is a spirit that has been trying to get close to you, or the seed will do that too if somebody's trying to put negative energy on you. So I think that sort of covers it. I think anybody, again, please, if you have a charm, a quincy charm, take it with you for any kind of blood work. Take it with you anytime you have to have anything medical done. It will make a huge, huge difference. Okay, we're done for this week, and we will see you next week, Wednesday. Thanks so much. Have a great week.